everyone, in this video you will see important CPC exam practice questions from anatomy, medical terminology, compliance and regulatory, and coding guidelines. These are important questions and it will be very helpful for your CPC exam. Let's start with the first question. An IOL would be inserted in which of the following surgeries? Option A, cataract surgery. Option B, tubal ligation. Option C, ankle arthroplasty. Option D, lap band procedure. The right answer is option A, cataract surgery. IOL is an acronym for intraocular lens. So it is an artificial lens that replaces crystalline lens following cataract surgery. Next question. Which of the following vessels is in the third order branch of the celiac trunk? Option A, gastroepiploic. Option B, left ulnar. Option C, left cerebral. Option D, right subscapular. You will find the answer for this in the Appendix L of the CPT code books. Under vascular families, when you check the first order celiac, you can find gastroepiploic in the third order. So the right answer will be option A, gastroepiploic. Next question. Which of the following best describes an acetabulum? Option A, a flat bony component of the shoulder joint. Option B, a bone in the middle ear. Option C, the hip joint. Option D, the base of the spine. The right answer is option C, hip joint. Next question. Which of the following is true regarding ICD-10-CM codes with the statement in disease classified elsewhere in their descriptions? Option A, they can never be the first listed code. Option B, they should always be the first listed code. Option C, they are unspecified codes and should be used only when more specific diagnosis cannot be found. Option D, none of the above. The right answer is option A, they can never be the first listed code. You will find this answer in your ICD code book, Section 1, Conventions General Coding Guidelines and Chapter Specific Guidelines. Under that, you will find Etiology Manifestation Convention, Code First, Use Additional Code in Diseases Classified Elsewhere notes. In that, they have given, in diseases classified elsewhere, codes are never permitted to be used as first listed or principal diagnosis. Therefore, the right answer is option A. Next question. What is the correct code to select when a patient is given oral contrast to complete a CT scan? Option A, select the code that includes with contrast in the description. Option B, select the code that includes without contrast in the description. Option C, select the code that includes without and with in the description. Option D, select the code for the scan without contrast and the code for oral administration. According to CPT coding guidelines, the phrase with contrast is used only when contrast is administered through three routes, that is intravascular, intra-articular and intrathecal. Okay, oral or rectal contrast does not qualify for with contrast. So, oral is considered as without contrast. So, the right answer is option B, select the code that includes without contrast in the description. Next question. Which of the following is an example of fraud? Option A, reporting services with codes supported by medical documentation. Option B, storing orders for radiology services in the film jacket. Option C, coding for an intermediate closure when simple closure is performed. Option D, having patients sign an ABN prior to a procedure that may not be covered. The right answer is option C, coding for an intermediate closure whenever a simple closure is performed. Next question. When should a provider have a patient sign an ABN? The right answer for this is option B. An ABN should include the items that may be denied and should be signed prior to performing the service. If you want to study compliance and regulatory notes and also some practice questions related to compliance and regulatory, then check my playlist CPC Compliance and Regulatory. Next question. When a service having both technical and professional component, example X-ray, is performed in the hospital, which modifier would be used by the physician? Option A 26, option B 47, option C TC, option D AM. The right answer is option A, 26. When a service having both technical and professional component is performed in the hospital, the physician may bill for the professional component only, and modifier 26 represents professional component. Next question. How often does CMS release updates for HCPCS level 2 codes? The right answer is option B, quarterly. HCPCS level 2 codes are maintained by CMS and they are released quarterly on the CMS website. Next question. When coding for a surgical service, which of the following is not included in global surgical package? Option A, digital block. Option B, general anesthesia. Option C, talking with the family. Option D, E&M encounter on the date immediately prior to a major procedure. The right answer is option B, general anesthesia. Because option A, C and D, digital block, talking with the family and E&M on the date immediately prior to a major procedure, all are considered included in a CPT surgical code. General anesthesia would be reported separately, therefore general anesthesia is not included in the global surgical package. Next question. Which of the following best describes psoriasis? Read the options. The right answer will be option C. Psoriasis is a chronic condition characterized by lesions that are red, dry, elevated and covered by silvery scales. Adrenal gland belongs to which system? Option A, endocrine. Option B, lymphatic. Option C, nervous. Option D, digestive system. The right answer is option A, endocrine system. Next question. When you see the symbol hash in front of a CPT code, what does it mean? Read the options. The right answer is option A. The code is listed out of numerical order. In your CPT manual, in the first cover page, they have given symbols and its meaning. In that, the symbol hash is out of numerical sequence. In what year did HIPAA become a law? The right answer is option B, 1996. Next question. The suffix algia means option A, pain. Option B, swelling. Option C, swallowing. Option D, inflammation. The right answer is option A, pain.